Welcome to this video on slit lamp examination. The slit lamp exam is a core part of the eye examination, and it provides you with a magnified view of the eye and surrounding structures, assisting you in the diagnosis of eye disorders. And with further training you can perform fine diagnostic and therapeutic procedures at the slit lamp, such as the removal of corneal foreign bodies. This video is divided into 4 parts. The first part describes the controls of the slit lamp and their functions. The second part describes the steps involved in a basic slit lamp examination. The third part involves troubleshooting and what to do if the slit lamp doesn't turn on. And the fourth and final section involves the correct documentation of your findings. The slit lamp has various controls, and it's important to know what each one does in order to use the slit lamp correctly. The first control is the on switch, which is located here on the power supply, which is usually under the table on the bottom left. Next to the power switch is a dial which adjusts the voltage, and this affects the intensity or brightness of the light. The slit lamp itself is divided into 2 parts, a microscope and an illumination system. The microscope is a binocular microscope. It has 2 eyepieces which converge, which give you a stereoscopic or 3-dimensional view. You can adjust for your own refractive error on each eyepiece by rotating the dial. Similarly, you can change the distance between the eyepieces to account for your own interpupillary distance by pulling them apart or pushing them together. You can adjust the magnification by rotating this dial. You want to start with a low magnification initially and then increase it at points of interest. In a normal microscope, we focus by moving the stage up or down. With a slit lamp, the patient's eye is in a fixed position. So to focus, we move the slit lamp either away or toward the patient. We can make gross movements by moving the entire slit lamp, or make very fine adjustments by using this joystick. Rotating the top of the joystick moves the slit lamp up or down. The illumination system is a short focus projector which projects a slit of light onto the patient's eye. And we can adjust the height of that beam, the width, the orientation, the brightness and the colour. This dial adjusts the height of the beam, and on the scale we can read off the height. Why would we want to do that? Well, say the patient has a high femur or blood in the anterior chamber, we can measure the height of that high femur. Or perhaps the patient has a corneal ulcer, we can measure the size of that corneal ulcer and follow them over time. Because we want to measure things both vertically and horizontally, we need to be able to rotate the beam of light, and we can do that by pushing this all the way to the left or all the way to the right. This lever adjusts the number of filters, and we've got neutral density filters which influence the brightness of the light. In this position there is a full filter, half filter and no filter, giving you the brightest light. Moving the lever further to the right will give you a green or red free light. Under this light, objects which are red, such as blood vessels, will appear black, making them easier to visualize. In most slit lamps, rotating this dial all the way to the left will give you a cobalt blue filter. And under this light, fluorescein dye will fluoresce green, which is useful for visualization of epithelial defects. We can adjust the width of the beam with this knob. You can also affect or alter the orientation of the slit lamp by moving the entire illumination system to the left or to the right. There are another couple of knobs to be aware of. Normally we want the slit of light and our microscope to be focused at the same point, and we call it coupled. And to achieve that, this knob should be tightened. We can also adjust the inclination of light by releasing this lever, but for most purposes the lever should be in the locked position. The slit lamp has a chin rest which can be adjusted in height and a forehead bar. Also, because of different heights of examiners and patients, we can move the entire table up or down by pressing this button. In other slit lamps, the button is located under the table. And either under the table or in this slit lamp, on the accessory tower, there is a drawer for storing accessories such as fluorescent strips. This section describes the steps involved in a basic slit lamp examination. The first step is to wash and dry your hands thoroughly. The next step is to disinfect the slit lamp, which should be done between each patient. At minimum, use an alcohol wipe to clean down the chin rest and the forehead bar. If the last patient's had an infectious condition such as viral conjunctivitis, the entire slit lamp should be disinfected. The next step is to get the slit lamp ready to use, starting with the eyepieces. If you don't have a refractive error or you're wearing glasses or contacts, you should set each eyepiece to 0. If, however, like me, you have a refractive error and you're not wearing glasses or contacts, you should dial in your refractive error into each eyepiece. You then want to set the interpupillary distance so that it's comfortable for you, and select magnification, initially a low magnification such as 10 times. The slit lamp is now ready to use, and you may want to do those steps before the patient comes into the room. The next step is to explain the procedure to the patient. You want to tell them that you're going to use a microscope to examine their eye, and that they'll see a very bright light, but that this light won't damage their eye. The next step is to position the patient, which is probably the most important step, both for patient comfort, but also to assist you in performing a good examination. You want to ask the patient to lean forwards and place their chin on the chin rest and forehead against the bar. Ask them to keep their teeth together and breathe through their nose to prevent their head lifting up and down with each breath. Also make sure that the patient's lateral canthus is aligned with the black bar. If it's not, adjust the height of the chin rest accordingly. You can also adjust the height of the table or the chair as needed for the patient's comfort. You're now ready to begin your examination. You should use one hand on the joystick and the other hand to control illumination. Make sure the slit lamp's not pointed directly at the patient's eye and turn on the lamp. You can focus it coarsely just by moving the slit lamp forwards until the beam becomes crisp and well demarcated, and then look through the eyepieces and adjust the focus accordingly. You want to start with a broad beam, relatively low intensity and a low magnification. And you want to have a systematic way of examining the eye, starting from out and moving in, examining the periocular skin, the lids, the conjunctiva in all directions of gaze, the cornea, the anterior chamber, the iris, pupil, lens, and anterior vitreous. To examine the cornea, initially use direct illumination to identify areas of opacity or other lesions, but then make a tall, thin beam angled at 45 degrees coming from the side of the patient's ear to avoid inadvertently hitting their nose, and this gives you an optical cross-section through the cornea and enables you to judge the depth of lesions. To examine the anterior chamber, use a beam about 2 to 3 millimeters high, increase the intensity, and you may also want to increase the magnification and turn off the room lights to aid in the diagnosis of anterior chamber cells. You should focus on the cornea and then push in toward the patient, and now you're focused in the anterior chamber. Normally you won't see any light reflecting back, but if a patient has anterior chamber cells, such as an anterior uveitis, you'll see light reflecting back in what looks like dust being hit in the sunlight. Then complete your examination by examining the iris, the pupil, the lens, and the anterior vitreous. You may want to perform special tests instilling fluorescein into the eye and using a cobalt blue filter to look for any epithelial defects. You may also want to put an anesthetic and check the intraocular pressure. With more experience, you can also use special lenses to examine the fundus. At the end of the examination, turn off the power supply to preserve the life of the bulb, and also tighten the screw to prevent the slit lamp moving inadvertently and being damaged. Sometimes you sit down at the slit lamp and you can't get it to turn on. If that happens, run through these steps. Make sure that the slit lamp is plugged into the wall and that the wall outlet is turned on. Some slit lamps also have a main switch located on the centre column. Turn that on. Check the main on-off switch under the table, and sometimes you'll find that there's a loose connection going to the bulb. If that doesn't fix the problem, check that the filters are not halfway between two filters, and make sure that the width of the beam is set to wide. If those steps don't fix the problem, then perhaps the bulb is blown, or perhaps a fuse has popped. in which case you should speak to someone in your department who's able to service the slit lamp. The last step is to accurately document and record your clinical findings. The ophthalmic examination, with the exception of visual fields, is drawn from the examiner's perspective, so that the patient's right eye is drawn on the left-hand side of the page. Down the centre of the page, record the following headings: lids, conjunctiva, cornea, anterior chamber, iris, pupil, lens and fundus. Outside of the ophthalmology department, the slit lamp is often an underused piece of equipment, but a basic slit lamp examination can be mastered relatively easily, and it provides a wealth of information in managing patients with ophthalmic conditions.